Traumatic brain injury is caused by an impact or insult to the head. The CDC estimates that 1.7 million Americans suffer a TBI every single year. Despite the prevalence of TBI and its possibility to lead to serious neurodegenerative disorders, the mechanisms of injury are not well characterized. Accurate in vitro models are necessary to understand what occurs at the cellular level in order to guide subsequent in vivo studies. Our group has approached this need by designing Cytoshear, an in vitro microfluidic device capable of applying repeated, tunable, subconcussive shear stress injuries to adherent cells, which can then be characterized to assess injury in real time.
A syringe pump pushes media in controlled rates through a Y connector. A pinch valve closes the tube leading to the chamber by default. To injure, the Arduino microcontroller signals the pinch valve to pinch down on the waste tube, closing it and redirecting the flow into our chamber and injuring the cells. Cytoshear allows us to finely tune fluid velocity in the tubes, giving us control over the magnitude of the injury. Severe injury causes more cell deformation, as seen on the right, compared to the mild injury on the left.
The chamber was modeled in COMSOL, and the expected shear stresses in the device were validated using particle velocimetry tracking. At the approximate cell heights in the chamber, we were able to reproducibly inflict shear stress injuries between 1 and 50 dynes, which has been shown to cause marked calcium influx in neuronal cells and covers a wide range of injury intensities.
We first injured astrocytes because they are key players in typical central nervous system injury response. Soon after a severe injury, there were no drastic changes in cell morphology. However, a full day later, they were noticeably rounder, an indication of cell detachment. Testing a milder injury, we saw a different response. It wasn't until a full day following the second injury that we noticed the cells were rounder and appeared to be detaching. This demonstrated our ability to injure cells with different intensities and subsequently observe different responses. Neural progenitor cells, on the other hand, have been thought to proliferate following injury. After we inflicted a severe injury, the cells aggregated to form regular spheres. Then, the cells reattached and continued to proliferate. Varying responses from different cell lines to the same injuries emphasizes the great versatility and tunability of the Cytoshear platform.
The use of Cytoshear as opposed to in vivo studies for these applications is also supported by reduction in cost. A Cytoshear kit capable of fabricating 72 test chambers would cost $348, while an equivalent number of in vivo tests would cost tens of thousands of dollars. In the end, Cytoshear offers novel capabilities to deepen our understanding of the cell-level effects of TBI, aiding development of new neuroprotective therapies, treatments, and diagnostics. Thank you to UCLA Bioengineering, Dr. Stephanie Seidlitz, Jesse Lang, and Rebecca Bierman for your invaluable support and guidance.